Everyone tells you how to get the baby out, but no one really tells you what happens after. Not the glowing part, the skin to skin, the newborn smell, the sleepy snuggles, but the real part, the bleeding, the hormones, the milk coming in, the way time seems to blur for days at a time, and the whole house feels like it's holding its breath. And if you're planning a home birth, or you've just had one, you might wonder what happens next once the baby is here and the room is quiet. The truth is, postpartum at home isn't just about recovery, it's about reintegration. It's about becoming a mother in your own space, without hospital buzzers or staff interruptions, without having to ask permission to hold your baby skin to skin for as long as you want. In those first hours after birth, your midwife stays with you. She monitors bleeding, makes sure the placenta is delivered safely, checks your vitals, stitches if needed, and gently examines your baby. It's quiet. No overhead lights, no rush. She might help you to the bathroom, help you into a fresh pad and mesh underwear, help you nurse for the first time. Then once you're stable, fed, and tucked in bed with your baby, that's when the real postpartum begins. Not the clinical part, the emotional, spiritual, nervous, miraculous part that no one else can truly describe. And you get to do it all from the safety of your bed. The first 48 hours at home after birth are unlike anything else in life. They're soft and raw at the same time. You'll feel everything: love, fear, awe, exhaustion, a strange alertness, and a kind of holy disorientation. You might shake from the hormones, cry for no reason, feel deeply bonded or suddenly overwhelmed. And all of it is normal. Your midwife will return for a home visit, usually the next day, to check on your bleeding, your baby's latch, your uterine involution, your vitals, and your emotional state. And unlike a hospital discharge, you're not being rushed out the door at 24 hours. You're allowed to be. Your only job is to rest, feed your baby, and let your body begin the slow, invisible work of healing. The bleeding might surprise you, heavy like a period at first, then tapering off over weeks. Don't be sore, maybe swollen. If you tore, stitched, or just pushed for a long time, you'll feel it. You might not poop for a few days, and when you do, it might make you cry. Your milk will come in somewhere between day 2 and 5, sometimes with an ache, sometimes with tears, sometimes with a wild primal surge of protectiveness you didn't know you had. Breastfeeding may not be easy, it's natural, but it's a learned dance. And in a home birth, you're not learning that dance under fluorescent lights with nurses tugging at your breast. You're learning it in your own bed, your own body rhythm, with a baby that recognizes your voice and smell. That matters more than people realize. You're not just recovering, you're emerging. And your partner, if present, gets to witness and support it all up close without a hospital schedule dictating when they can hold the baby or when you need to be wheeled out. Postpartum at home isn't perfect. It's intense and intimate and sometimes scary, but it's real and it's yours. The first week passes like a dream you half remember. Days and nights melt together. You'll watch the sunrise while breastfeeding, nap at 2 p.m., and forget what day it is. And that's exactly how it's supposed to be. In the first 2 weeks, your midwife will come back once or twice, depending on your needs. She'll check baby's weight, look at how your uterus is shrinking, and gently ask, "How's your heart?" And that question might make you cry, not because something's wrong, but because someone asked. You might feel a deep sadness you can't explain. You might feel joy so big it scares you. You might grieve your old self while loving your new one. Your body will be different, softer, looser, open in places no one warned you about. Your belly may feel empty and strange. Your breasts may ache, leak, and swell. But what you'll remember most is the tiny movements, the curl of your baby's fingers, the weight of their body sleeping on your chest, the sound of your own breath slowing as you rock them at 3 a.m. Visitors may want to come. Some will help. Some will take your energy. You'll learn the difference fast. At home, you get to choose who enters your space. There's no parade of nurses, no loud carts, no roommate separated by a curtain, just you, your baby, your chosen people, and silence when you need it. And don't forget, you need to eat more than you think. More fat, more salt, more broth, more protein. Your organs are repositioning, your blood volume is shifting, your hormones are recalibrating. This is not the time for bouncing back. It's the time for going inward, staying still, and letting yourself be held. Because that's what postpartum at home really is. In a container, a soft cocoon around your most raw, holy transformation, not rushed, not interfered with, not medicalized, just honored. The 6-week mark comes quietly. No sirens, no fanfare. Just you, your baby, your healing body, and the quiet realization that something inside you has shifted forever. You may still be bleeding lightly. Your pelvic floor may still feel fragile. Nursing might still be hard, or it might now feel like second nature. Some days you'll feel strong, walking a little further, holding your baby with more ease. Other days, you'll cry brushing your hair or forget when you last showered. This is the slow dance of becoming. At your final midwife check-in, it won't be about discharge papers or follow-up appointments. It'll be about integration. How do you feel as a mother? What surprised you the most? Where are you still tender? And she'll sit with your answer, not rush it. Because postpartum isn't a box you check. It's a doorway you walk through. Homebirth allows you to pass through that doorway surrounded by familiarity, slowness, warmth, and autonomy. You weren't monitored under fluorescent lights. You weren't woken every hour for vitals. You weren't told when to eat, when to feed, when to walk. You were trusted, you were witnessed. And in that trust, something else begins to grow, not just your baby, but your confidence, that deep, almost primal sense of, I did that. I brought life into the world and I knew what I needed. And that energy ripples into everything, how you advocate, how you rest, how you show up in your relationships, how you make choices going forward. Birth shapes you, but postpartum cements you. And when that process happens in your own space, on your own terms, with care that sees your wholeness, the outcome isn't just a healthy baby. It's a mother who feels powerful, connected, and unshaken. That's the kind of postpartum story no one puts in brochures, but it's exactly what's possible, and you deserve nothing less.